Hello, my name is Hyo Ju Lee and I work at Seong Woo Yun University. The title of my study is Developing a S-PBL module and its effectiveness in respiratory care. This is the table of contents. It's an introduction. According to the running pyramid, which studied the effects of students' various running methods at the U.S. National Training Laboratories, teaching friends is 18 times more effective than just listening to lectures. Universities are introducing more runner-centered classes to replace traditional lecture and instructor-centered classes. At each university, the Center for Teaching Running and the Curriculum Innovation Center analyze curriculum trends and support the use of problem-based running, discussion-based running, team-based running, and flipped running teaching methods. PBL classes refer to instructional design models that allow learners to self-directed running through the process of solving practical problems related to field practice, away from allowing instructors to run based on lectures. It was first started in the 1960s at the McMaster Medical School in Canada and has recently been applied in various academic fields. Looking at the actual PBL class example, learners' learning goals are not only achieved but also various competencies such as problem-solving ability, practical skills, and teamwork are cultivated through team cooperative running and self-directed running. Patients encountered within the emergency medical system deal with complex and diverse health problems, so it is important to improve these various practice-oriented competencies for EMT. This study aimed to develop a simulation PBL module for medical emergencies and practice courses with cases involving patients with problems in their respiratory system. This S-PBL was applied in the form of blended running for a class of EMT students, and a qualitative survey of satisfaction was conducted in the runner group using FoCoS group interview. It's a research method. This study developed a S-PBL module for medical emergencies and practice courses, which was applied to 16 EMT students in their third year at S University in Chungnam. All learners completed 48 credits of major subjects such as basic medicine, patient management and practice, and emergency patient assessment and practice. The developed module was used from weeks 11 to 13 of the 15-week class and was operated as an offline class in weeks 12 and 13, excluding some hours. After class operation, this course was judged suitable for basic certification through expert consulting from the Institute for Innovative Education of S University. The PBL module developed in this study was designed based on the PBL instruction model by Bellow and Meyer, as shown in table. In the class operation stage, mini lectures and skill practice opportunities were provided, allowing a team of 4 to 5 people to perform the problem-solving process faithfully. During the module, learners produced scenarios and operated simulations through given problems. The problem will appropriate for the level of the students taking the class, or problem that students will likely to encounter in the real world, and those where various solutions could be found. The score sheet was created by modifying and supplementing the simulation evaluation sheet for the assessment and treatment of patients with respiratory disease obtained during the Korean Advanced Life Support Provider course that was developed, certified, and operated by the Korean Association of Cardiopulmonary Resuscitation. In addition, after completing the problem patient case and score sheet, the content validity was ensured through evaluation by 2 professors from the Department of EMT. Its result and discussion. As a result of the class satisfaction survey, scored on a 5-point scale, the intermediate evaluation score for the lecture style class was 4.76, whereas the class satisfaction score increased by 0.16 points to 4.92 points after applying the PBL module. It was beneficial to integrate the knowledge learned through PBL activity and to reconstruct and operate it in a real situation, with the runners themselves confirming that their problem-solving ability and various major competencies are improved. The effectiveness of class operation with the developed PBL module was evaluated by a qualitative study using FGI with 5 runners. The analysis revealed that the students experienced a need for modification of running strategy, self-efficacy, and cooperative running through the class with the S-PBL module. Furthermore, the runners were determined to have experienced improvement of running concentration and reduction of participation in class with non-face-to-face class. This is the final conclusion. This study is conducted by adapting simulation problem-based running to medical emergencies and practice courses with a case of the dyspnea patient intended to be applied to the curriculum for emergency medical technician students, and aim to analyze the effectiveness of the module within the class with focus group interview. The developed S-PBL module was designed to solve the problem by focusing on my major emergency cases with mini lectures and team discussions. Also, it is designed to directly and indirectly evaluate the skills of communication and cooperation, as well as the emergency communication ability, emergency patient assessment ability, and advanced treatment ability that are the core competency of EMT proposed on the report by track. The developed module was certified through expert consultants formed by the Institute for Innovative Education of S University. It was analyzed that learners experienced the needs for modification of learning strategy, self-efficacy, and cooperative learning through classes using the S-PBL module developed in this study. And the overall class satisfaction show a high level as per 0.92 points. Emergency situation experienced by EMT require various competencies such as problem-solving ability based on critical thinking, situational judgment, communication skill, and attitude. This improvement in competency was found in the teaching method using S-PBL. Thank you.